The world is reeling under a severe pandemic for almost 1.5 years now. With millions of people infected and killed, the human society is working on war footing to save lives and livelihood. But this is neither the first time such a massive invisible killer has prowled among us and killed millions, and nor will it be the last. Exactly 100 years ago, the 1918 Spanish flu pandemic swept across the globe and killed men, women and children by the millions without discrimination. A world recovering from the First World War that had killed some 20 million people suddenly was plunged into another fiery pit of a deadly pandemic. The pandemic, which became known as Spanish flu, is thought to have begun in the cramped and crowded army training camps on the Western Front. The unsanitary conditions, especially in the trenches along the French border, helped it incubate and then spread. The war ended in November of 1918, but as the soldiers returned home, bringing the virus with them, an even greater loss of life was just around the corner. Between 50 million and 100 million people are thought to have been dead in the Spanish flu. With the current COVID-19 pandemic sweeping across the globe and dismantling even the most modern health infrastructures, we take a look back at the last time a similar yet far more deadly predicament came upon the world, what we learned and what we didn't learn from it, and try and predict how the current pandemic can actually come to an end. In March of 1918, a mysterious illness was detected among soldiers in a Kansas Army base. Soldiers at Fort Riley were suddenly dying from a flu-like disease. But due to wartime restrictions, this outbreak and others around the world were not widely reported in the press. As Spain was neutral, these restrictions did not apply. So when King Alfonso XIII became gravely ill in April 1918, the news spread, which gave the impression that Spain was the most affected country. The flu was first noted in Britain in May 1918, supposedly arriving through the port of Glasgow, and by June it was already in London. As in the USA, the British press had difficulties reporting the seemingly irrelevant flu outbreak while war was still raging on the continent. As a result, many people were unaware of the virus, and only localized precautions were made. The world in 1918 was a far more localized world than the world we live in today. As a result, public information pertaining to the flu was few and far between. Conversely, in the present day, we are instantly able to access the latest available data on the COVID-19 pandemic from infection rates, daily death toll, or even government advice. Our current understanding of the virus is beyond the comprehension of even the top scientists of 1918. Having only been discovered at the end of the 19th century, public health was in its infancy, and epidemiology was non-existent. This helps to explain why the worldwide spread was so fast and so vicious, and why the exact figures on those affected are still unknown. This also nails down the importance of availability of free and clear data on a global pandemic, even if governments, especially in developing countries like India, try to keep exact death and infection numbers grossly underreported or hidden. We can never hope to fight a killer that spreads without borders and kills without mercy with politics. A phrase many of us would not have come across until March of last year is social distancing, in which we have been encouraged, or in some cases forced, to keep away from other people. This was also used in 1918, with a comparable response to now, as many schools closed and public events were cancelled. Cheltenham Boys' School did the reverse by locking the pupils and staff inside the school building. Meanwhile, across the Atlantic, a measure introduced to reduce contact in the most populated city included the staggering of rush hour by New York City's Health Commissioner Dr. Copeland. Restricting what people can do is always hotly debated, and the recent debate in the press on the need to wear masks while in public spaces and on public transport is not a modern concern. Historian Samuel Cohen has referred to the Anti-Mask League of San Francisco in early 1919, which gained backing from several thousand people opposed to wearing a mask. Contrast that to 2020. Even when the pandemic has killed millions of people worldwide, there has been protests and demonstrations against masks, lockdowns and movement restrictions. Even when having a living example of the Spanish flu epidemic, what devastation can occur if the virus is allowed to spread without inhibitions, yet we fail to learn from history and bring the society and the healthcare systems to the brink of collapse, just like we did 100 years ago. Even if air travel was still in its infancy when the Spanish flu struck in 1918, there were only a few places on Earth that escaped its horrific effects. Its passage across the world was slower, carried by railway and passenger steamer rather by airliners, but still it spread nonetheless. Some places held out for months or even years before the flu arrived and wreaked its terrible toll. It was evident that the biggest killer was human movement. In the wake of the Covid-19 pandemic, almost all the countries were reluctant to restrict movement and rein in air traffic. By the time the governments decided to suspend air travel, the virus has already spread far and wide and started wreaking havoc. The fact that the lethality of the current pandemic is far less than the Spanish flu, even in a highly connected world, is due to better intergovernmental collaboration and an overall better geopolitical relations than the world of 1918. Doctors have described the Spanish flu as the greatest medical holocaust in the history. It was not just the fact it killed so many, it was that so many of its victims were still young and healthy. Normally, a healthy immune system can deal reasonably well with flu, but this version struck so quickly that it overwhelmed the immune system, causing a massive overreaction known as a cytokine storm, flooding the lungs with fluid which became the perfect reservoir for secondary infections. Older people, interestingly, were not as susceptible, perhaps because they had survived a very similar strain of flu which had started to spread through the human populations in the 1830s. With the new coronavirus or SARS-CoV-19, the elderly people and people with pre-existing illness are considered to be most at risk. Although still low, deaths have been the highest in those aged above 80 years old. But with the second wave and the newer strains that has developed in the recent months, more and more young adults are being affected and even killed. In the current COVID hell that is going on in India, the virus is sparing no one, as both the old and the young are being lethally infected with it. In a recent report by top government medical experts from India, states that although the percentage of young people getting infected in the second wave remains fairly equal to the first wave at 32% compared to 31% previously, the virus is proving to be far more lethal and life-threatening in young people than the first time around. If this can teach us something, is the unpredictable nature of biology. There is no guarantee against the virus, no matter what age group we belong to, and an equal measure of protection should be taken by both the old and the young. The Spanish flu broke out in a world which had just come out of a global war, with vital public resources diverted to military efforts. The idea of a public health system was still at its infancy. In many places, only the middle class or the rich could afford to visit a doctor. The flu killed many in slums and the other poor urban areas among populations with poor nutrition and sanitation, and often those with underlying health conditions. The flu spurred the development of public health systems across the developed world, as scientists and governments realized pandemics would spread more quickly than they had in the past. Treating people on a case-by-case basis would not be enough. To deal with pandemics in urban settings, governments would have to mobilize resources as if they were at war, quarantining those showing signs of the disease, keeping minor cases separate to those suffering from more serious illness, and limiting people's movement so the disease would burn itself out. The public health measures we see being enacted today across the world as efforts to contain the spread of coronavirus are one of the Spanish flu's most enduring effects. In the case of the 1918 pandemic, the world at first believed that the spread had been stopped by the spring of 1919, but unfortunately it spiked again in the early 1920s. As with other flu strains, this flu may have become more active in the winter months because people were spending more time indoors in close proximity to one another, and because artificial heat and fires dry out skin and the cracks in the skin in the nose and the mouth provide great entry points for the virus, explains Howard Markle, physician and director of the Center for the History of Medicine at the University of Michigan. Flu does tend to go quiet when the cold weather regresses, but no one knows why, Markle says. But by the middle of 1920, that deadly strain of flu had in fact faded enough that the pandemic was over in many places, even though there was no dramatic or memorable declaration that the end had really come. We find ourselves in a similar situation. At a time when people thought that the pandemic is coming to an end, it made a swift and even more deadlier return in varied mutated forms and proved to be even more devastating than the first wave. At this point of time, our best bet for the end of the pandemic is the vaccines. Due to massive advances in medical sciences in the last 100 years, we were able to develop vaccines at a tremendous pace, and while they do not provide 100% immunity against the viruses, still greatly increases our guard against the deadly killer. The end of the 1918 pandemic wasn't, however, just the result of so many people catching it that the immunity became widespread. Social distancing was also key. Public health advice on curbing the spread of the virus was eerily similar to that of today. Citizens were encouraged to stay healthy through campaigns promoting mask wearing, frequent hand washing, quarantining and isolating of patients, and the closure of schools, public places and non-essential businesses. All steps designed to cut off routes for the virus spread. Despite of vaccines, all these measures still remains key to bring the end of the virus and will continue to play a major role in the containment. History is the best teacher for survival, but it can be a crude educator as well if we are not able or willing enough to learn from it. While we have taken great measures that were unthinkable in 1918, we have also faltered on so many fronts that it's inexcusable and has caused a terrible loss of lives across the globe, when we could have been far more equipped to handle something like this on a global scale without bringing societal infrastructure on the brink of collapse. I hope you found this video interesting. Do leave a like on this video if you think this is informative and subscribe to the History Simplified channel. Share this with your friends and family so that more and more people are made aware of our history and how that can affect socio-political scenario even today. Stay informed, stay curious, and I will see you on the next one.